Yesterday, 403 new COVID-19 cases were confirmed and added to the number we have to increase the total to 16,085 that have been registered in Nigeria. We have treated and discharged 5,220 persons and sadly lost 420 to COVID-19. The case fatality rate remains at about 3%, which is lower than many countries, but not a cause for relief. The increasing pace of testing will yield more cases, but we need to also be proactive in keeping fatalities low, and this is not impossible. It is still strongly advised that those who test positive present themselves at a treatment center, and this is most especially so for those with underlying ailments like diabetes, hypertension, cancer, HIV, tuberculosis, or those who are 60 years old or above. These are the vulnerable population and form the majority of fatalities of COVID-19. The reason for giving special attention to this category of people is that COVID-19 symptoms can start very mildly with slight fever, slight cough, loss of sense of smell or taste, but suddenly escalate within days or hours to shortness of breath in no time at all. In conversation with Lagos State authorities has reported that people who delay going to hospital and begin treating themselves at home are at risk, and they are the majority of the victims. And those who have had underlying ailments and delay are the ones who barely can make it to the doorstep of the hospital. Early registration for treatment for vulnerable population will save more lives. Our response in tracing, testing, and case management is driven by data and evidence. I will continue to adjust our protocols for quarantine and treatment accordingly. We are collaborating with states to strengthen the response according to needs. An arrangement has been reached to send such a collaborative team to Cross River State in the next few days to complement the work of the state government there. Apart from fighting COVID-19, the state government is also engaged in border patrol work because of the border they share with Cameroon and the unrest on that side of the border. The team to Cross River will be led by the Executive Director of National Primary Healthcare Development Agency, Dr. Faisal, and will engage in a technical handshake with the State Emergency Operating Center. Representatives from all departments and agencies, including NCDC, will be invited to go along, and also the Department of Family Health, Hospital Services, and epidemiologists. And because of the fact that they have a port health services will be included. Efforts are ongoing to increase the number of laboratories, and with priority given to states which presently do not have a laboratory with PCR capability, and these will include Cross River, and Kogi states. We plan to be able to engage Kogi State in a similar manner within the next few days. We commemorated World Blood Donor Day yesterday, Sunday, and the theme of which was Safe Blood Saves Lives. That occasion was a clear reminder that despite COVID-19, other diseases and other problems still remain within our health system. We must not forget those ones. I interacted with Nigerians on social media platforms on the importance of blood as a critical and indispensable healthcare requirement for life-saving in maternal and child care, especially bleeding after delivery, severe anemia, sickle cell anemia, and in saving lives of victims of accidents. All of these are still going on as we talk. The advent of COVID-19 has affected the collection of blood and processing of blood because donors are not coming out as they used to. I had the honor of meeting with Mr. Akpan Nathan, a voluntary donor who holds the record of having donated blood 63 times. I salute him for his contribution. COVID-19 will be with us for a long time, and we shall keep learning as we go along. As part of that, the Ministry of Health is just putting finishing touches to a health sector response action plan to cover the next 3 years, divided into near, medium, and long term. It will be, of course, subject to modification as we learn more about COVID-19, but we provide guidelines for the health sector on how to prepare and rearm itself. It's a work that has contributors from some of the most learned experts in this country. Before I take my seat, I wish to advise again that we all adhere to the advisories on hand washing regularly or the use of alcohol-based sanitizers, to maintain physical distancing, and to use a face mask at all times when outside the homes. I shall be showing a small clip that came from outside the country that demonstrates of wearing a mask, as simple as it is in protecting oneself. The mask is not the only protection you can have. It is recommended to be something you use along with other measures. And I shall urge you all to look at this one carefully and learn some lessons from it. Thank you very much.
Today, I will follow on the same theme because it's very important. Understandably, we are all craving for a return to some sense of normalcy. And in the past weeks, people have become very anxious about this and have really challenged all the norms that we have tried to introduce across the country. Everywhere around us, we see an increase in high-risk behaviors that is inevitably leading to more transmission. We're seeing cases increase. We're seeing deaths increase. Yes, we know it's hard to completely prevent exposure, but we have to do that which is possible for us to do. Just like we've seen from that video, there are many important lessons to learn from other countries. But there are also many lessons to learn from countries. If any of you has watched events out of Brazil in the last few days, and you're Nigerian, you'll be worried, because we have a lot in common with Brazil. And yet, they have the second highest death toll in the world right now. If you're also interested in learning what is happening in India, another country that has a lot in common with us, they have the fourth highest number of confirmed cases in the world. We're seeing an increased number of cases, and we really have to think about this in very clear and unambiguous terms. It's not just in Lagos. Yes, our highest number of new cases is still in Lagos, but we're seeing increasing cases in many states across the country. And yes, we have eased the lockdown, not because we wanted to, but because we had to, in order to sustain livelihoods. And the chair of the PTF has referred to this severally. But we simply have to take more responsibility around the three interventions that are in our hands, around mass gatherings, and hand washing. I call them the MMW. Many people call them different things, but it's extremely important that we do more of this. And yes, that a church or a mosque decides to open doesn't make it compulsory for you to attend. Attendance is still a personal choice. That the supermarket in Abuja decides to do a concert doesn't make it compulsory for people to attend. The attendees are making a personal choice. Yes, there will be circumstances where it will be difficult to make those choices, but at least in things around leisure, those are the things that we have to make some personal sacrifice around. And even when airlines open and when travel open, we all have to think very hard. How important is that trip to us? How important is it? And this will be hard choices. The hardest choice is probably that of my brother, the Honorable Minister of State for Education, because we all know how important education is for our children. But we have to do the ones that we can do. And that's really why today you'll see from the chair of the Presidential Task Force, from the Honorable Minister of Health, and from the few comments I'm sharing, we really have to push harder on the things that are in our hands, those things that we can do. If you doubt that they work, you can look at the evidence around it. We must just do it more, do it together, and do it consistently. And yes, behavior change is hard. Many of us lived in Nigeria when the wearing of seatbelts, the not wearing of seatbelts was the norm. But now everybody goes into a car and puts on a seatbelt. It was a new norm a few years ago that became the norm. So we may not get there with face masks forever, but we do have to do this for the next few months. So we have to make it socially unacceptable to be seen outside the home without your face mask. And we have to hold each other accountable for this. We must push harder on each other to wash hands and surfaces regularly. And finally, we must discourage each other from mass gatherings that are not necessary. In the mass gathering that happened in Abuja that has been all over the social media, there were people there, Nigerians that looked at each other in the eye and said nothing, and celebrated each other for being there. Not a single person stood up and say it in the context of what is happening. For the sake of my parents at home, let's stop this concert. So yes, there will be a lot of discussion about the mall, about the regulations, about the flights, and you'll hear some of them. But for me, the most disturbing thing is the people that attended and said nothing and enjoyed that day with everyone else. So I'd like to end by just saying the health of each of us depends on the actions that each of us is going to take over the next few months. Thank you.
The Chairman of the Presidential Task Force, Honorable Ministers, members of the PTF, gentlemen of the press, good evening. So first of all, I would like to just say that we had a very useful and productive meeting with members of the Public Accounts Committee today at the National Assembly from the House of Representatives side. It was very clear from the discussions we had, this was really a fact-finding and information-sharing event, but it was very clear from the discussions we had that there continues to be some confusion about the funding stream in terms of the PTF and how the COVID program is funded across the country. So there are several funding streams. If you look at from the government side, from the federal government side, there are 2 or 3 funding streams. The first one is money that is derived from the MDAs that represent PTF. This is the 2020 budget that has been identified for the purpose of COVID. And this money belongs to the MDAs, and they are responsible for spending the money. We then have a special intervention fund. That special intervention fund, as approved by Mr. President, is specifically for the purpose of COVID-19. And that money at the moment, which is about 22 billion, sits with the PTF, and the different MDAs all have a share of it, but they can only spend it following strict rules in terms of their submissions, in terms of submitting a procurement plan which will be approved, in terms of submitting a work plan, and if they have spent money, they need to provide a retirement in order for us to pay. At the moment, with that specific amount, we have only spent 0.02% of that. Most of it went towards the evacuation, towards the accommodation of Nigerians that were brought in the last few weeks. That money will be spent if the level of evidence provided to the PTF is good enough. It has to be good enough for the MDAs to be able to spend money. It has to be at the same level as you would expect with the different MDAs. There are some commitments that are going through, but the key thing to remember is we have to have transparency and accountability, and those funds will only be spent if there is clear justification that the process that needs to be followed has been followed. So that's the government side. We then have the private sector. From the private sector, we have CARCOVID, which is the Coalition Against Coronavirus Disease, which is co-chaired by the CBN Governor Alhaji Aliko Dangote, and the Chief Executive of Access Bank and some business entities. This is an entirely private sector arrangement. It's an initiative of the private sector. We do not see that money. We do not touch that money. And we can only provide advice to them in terms of what we feel they should do that will be in the best interest of the country. So for instance, we could say to them, well, we need isolation facilities in this city, or we need to increase the number of critical care beds in this city, or can you help us to fund testing, additional testing? For instance, with the Nigerians that are being evacuated at the moment, for Abuja, part of that testing is being supported by Dangote Foundation and initially through arrangements with CARCOVID. So that's where they fit in. We do not keep their money, we do not touch their money, and we do not have any oversight of their money. This is a private sector arrangement. And then there's another funding stream which is from all of you Nigerians. And this is money that is paid into about 5 commercial accounts, ranging from, I think, First Bank, GT, etc. And it has already been advertised. And these accounts collect money across the board from Nigerians. At the moment, I think that's about 850 million. And the money is then mopped up on a weekly basis by the Accountant General and kept with the Accountant General. And the money will then be utilized later on to supplement what comes to the PTF in terms of the Special Intervention Fund. But I must emphasize, the PTF is not a procuring entity. Neither is it an entity that has accounting rights in the same way that MDAs have. But we do authorize payment to the Accountant General if the process has been followed by those MDAs. And then we then have a host of other entities that provide commodities. But before then, I'll talk about the UN Single Basket. Again, the UN Single Basket is a conglomerate of mostly multilaterals and bilaterals, including the EU and the UN system. And they have their own system as well. Their money stays with them, but we support them by providing proposals that go through the UN system. They are acknowledged, they are approved, and then their money is spent. Again, the money does not come to us. We then have entities that provide donation in kind. So commodities, PPE, test kits, etc. We will have a live dashboard that we will make available. We are committed to transparency. We'll make available that live dashboard that will show clearly what we have received as government for the COVID response. How many PPEs we've received, where they have been sent to, how many test kits we've received, and what our current stock levels are, etc. We will make available that, and we will also make available our harmonized budget once the new budget is finalized by the National Assembly. So that's to do with the expenditure. I think it's important for the general public to understand the process. In terms of flights, I'm sure the Honorable Minister of Foreign Affairs may want to update us further, but just wanted to let you know that so far we've brought in just over 300 Nigerians, and this week we will start the process of bringing in up to 500 persons into Abuja and 500 persons into Lagos. The key criteria for coming into the country is the need to have a PCR test for COVID-19 before boarding, and this needs to be valid within a 2-week period. We are aware of the difficulty of obtaining this test in certain countries, and we'll be looking at this in further detail, but we can already see some of the advantages of having this pre-boarding test. We had a host of Nigerians that were tested last week, and some of them were positive, and we had to decline boarding for them. We hope they will clear their infection so that with the next cycle of flights, we'll be able to bring them home. My appeal really is to those that are coming in, the evacuees, to please cooperate with our guidelines, and when we ask you to self-isolate at home, please do so. We will arrange for a repeat test, but you need to self-isolate for 14 days regardless of the result of that test, because you could be in the incubation period. And I would like to express our gratitude to Dangote Foundation as well as the Lagos State Government for making this process as smooth as possible. Finally, the DG and CDC has already mentioned this, but we continue to be very concerned about the level of compliance with some of our guidelines, particularly looking at what's happened in Abuja over the weekend. It's very important to say that this pandemic is far from over. Do we want to get back to normal? Yes. If we want to get back to normal, then we need to start complying with the guidelines. The earlier we comply with the guidelines, the faster we'll be able to get on top of this pandemic. There are no two ways about it. Behavioral change is the only thing that can overcome this. We already have a lot of Nigerians dying. At the last count, more than 400 have died from this pandemic, people that possibly could have been alive with us now if they hadn't contracted it. I know it's very difficult. Behavioral change is very difficult, but some aspects of it, like hand washing, for instance, is part of and parcel of our culture. As we say, cleanliness is next to godliness. So to say that we are tired of washing our hands, I'm afraid is not a good excuse. It's important that we continue to maintain our personal hygiene, and it's part and parcel of protecting ourselves from COVID. But more importantly, we are relying on the public to please be each other's keeper and to respond and remind people that are not wearing masks in public to please do so. Thank you.